Hi, I'm Jeff Hayes, the executive producer of The Healing Miracle. I'm about to do something I've never had to do before any docuseries or any documentary that I've ever produced, but I actually wanted to put on the front of this a disclaimer or even a warning about what we're talking about. In this series, we have about 70 different experts. It's a very controversial topic, and I have some very controversial people in this series. We have people that are using cord blood stem cells. We have people using amniotic tissue. We have people using adipose tissue. We have people using bone marrow as the source for stem cells. They all think that they're the best. And to some degree, they disagree with one another, and the FDA disagrees with a lot of them. Because of this, I didn't favor any one company. I tried to bring you the information that you'll need to make a decision. For me, I love stem cells. I think that it is the greatest advance in medicine since the antibiotic. But I'm a filmmaker. Don't take advice on anything but filmmaking from a filmmaker. This doesn't replace your relationship with your doctor. My goal was to try to bring you all the information that you would need to make a decision. You'll see in this series, one of the things we have in there is I actually was injected with stem cells, so it's pretty clear where I landed on that. But like I said, I'm a filmmaker, not a scientist. I hope I brought you the information you'll need. The reason for this warning up front is don't watch 15 minutes of this and then run out and get stem cells. You don't have to watch all of it, but watch a significant amount of this series because there's a tremendous amount of information here. It's an incredibly controversial subject, and we're bringing you some very controversial people. I think at the end of it, you'll have everything you need to know about whether you want to use stem cells for your health. For me, I do know that I believe that we have the right to use our bodies to heal itself, and I think this is a spectacular way to do it. I hope you enjoy The Healing Miracle. I think we did a good job, and I hope you like it.
We are already at episode 9, and you know what? We haven't slowed down our pace at all. We are still offering really important information. And I have a question for you, Sarah. What's the difference between amniotic tissue and cord blood?
It's a great question, and one that I was really curious about as well. So what happens is a mother decides that she's going to donate her sac and her umbilical cord from her alive, healthy birth to science. Now, first, these women are screened to make sure they're completely healthy. They have C-sections and live, healthy births. Then what happens is the umbilical cord and the sac gets taken to a lab where the stem cells from the cord and from the amniotic tissue is harvested and banked and then used for stem cell treatments. Now, I happen to have had amniotic tissue injected in both my knees.
Again, want to thank you so much for taking this journey with us. And right now, let's start episode 9.
My name is Dr. Tami Meraglia. I'm a double board certified MD. And what I do most of the time is I am a stem cell surgeon. I own a practice called the Seattle Stem Cell Center. It's in Seattle, Washington. And we have other doctors in other parts of the United States as well. And we treat conditions that traditional medicine has really not done a good job or has been unsuccessful, or the side effects are terrible, or the surgeries are just too daunting. And it's wonderful that your own cells could be the solution for your conditions.
So what type of things do you treat? What do you see the most of in your practice?
Well, I'm part of a national clinical trial, so that excludes us from treating conditions like cancer and infections. But other than that, we treat a variety of conditions. Some of the more common are MS and Parkinson's and autoimmune conditions, osteoarthritis, COPD and emphysema, traumatic brain injuries. My husband had a shoulder that he was told needed a replacement surgery, and we treated him, and he's perfect. He's lifting weights, he's out of pain, My father is the reason that I got into stem cell medicine. He has COPD, and he has had a worsening condition. There's no treatment for COPD, it's just comfort. And he was on 5 liters of oxygen, and we did his stem cell treatment, and he doesn't use oxygen anymore at home. And he uses 3 liters when he walks and exercises. So I love that there's objective data showing this. It's not just that people are feeling better, though that happens. It's that we're changing these people's lives and changing their conditions.
Well, let's first talk about your husband and then your father. So your husband, what did he do to his shoulder? What was the nature of his injury?
Well, he used to be a fireman, so he did a lot of pulling heavy things, and then his stress release is working out and lifting weights, and so he had a torn rotator cuff, and then the joint had just worn down. So he was told by the orthopedic surgeons that he should have a shoulder replacement surgery, but he was young, and so he should stop lifting weights and, you know, try to wait as long as possible. It's funny because it really affected our marriage, because when he laid on his back, he would snore. And then I'd elbow him and he'd roll over onto his shoulder and it would hurt. And then he'd roll back on, and it was just terrible. So it helped our marriage too, because we can both sleep now.
Well, I also imagine the chronic pain is affecting him. Well, one, it's affecting his work.
Yeah.
His ability to work, and just, you know, his ability to do something that he likes and relieves stress. That's,
Yeah, he couldn't play with our girls, throw a ball, and do all the fun activities because he had this limit of function and pain, and it's completely gone.
Okay, so what was the treatment? What exactly did you do?
So we did, what we do is an autologous fat stem cell. So it's from you. I do a little bit of liposuction. Nobody minds donating a little fat. And then that takes about a half hour, 45 minutes. And then we have about an hour that we're going to process the cells and concentrate them and prepare them. Our patients usually go for a walk or have lunch, and then we inject the stem cells and the stromal vascular fraction back into the joint and an IV.
So you put it directly in the joint?
Yeah, just like a cortisone shot. You know, we look at the x-rays and see where it needs to go so that we can direct it properly. And, you know, I used to work in sports medicine, so I've done a lot of joint injections over time.
So you injected it into his joint, and then what did you do intravenously?
100% of the patients get an IV as well of their own cells, because your whole body is involved in your inflammatory response. And so stem cells are very anti-inflammatory, and it allows sort of an upstream approach. That's also the way that we have shown in our study that it's effective for the chronic conditions like MS and Parkinson's and autoimmune conditions.
So let's talk about your dad. Now, I always see ads on TV for COPD medication. I imagine they have all kinds of side effects. Can you talk about that?
Well, they have side effects, but also they don't work. You know, the pharmaceutical companies do a good job as much as they can, but for many conditions, they're not interested in curing it sometimes, I believe, because, for example, diabetes and things, it's really addressing the symptoms, not the root cause of the problem.
Right.
And with COPD, it's about making the patient comfortable and delaying the progress of the condition, but there's no cure.
So your poor dad was on all this oxygen, literally tethered to a tank.
Yes, he had a small sort of compressor, but yes, he had to go everywhere with this oxygen.
And so how did you sell him on this?
Well, he was my first patient. I got
wow.
into this because of my dad.
Wow.
Yeah.
And so you said, Dad, I'm going to try this. And
Yeah.
so what was the treatment, the specific treatment for your father?
I gave him an IV stem cell treatment. I took a little bit of his fat and put it in IV. The venous system goes directly to the lungs first. The beginning of the study, we tagged the stem cells and watched where they went in imaging. And so we know that all the stem cells went to the lungs first, and they hang out there for a while. And then they go to all the areas that a homing device brings them to that have inflammation and need. It's remarkable.
It's a miracle.
Which I guess isn't so astonishing. I mean, when you cut your finger, you don't have cells grow on the end of your nose. Somehow, your body knows just to grow new skin cells right there. So we're just tapping into this innate healing.
So how many treatments have you given your father?
He's only had one so far. He's coming up to do his next treatment. Just, kind of the plumber's sink. Hard to get him to commit and hard to get the time and
Right.
all of that. But he had a great response with the first one.
And how quickly did you see that response?
We typically see that patients feel better right away, and then the real effects take about 2 to 4 months, and that's probably because your cells live for about 3 months. And this is really resetting the button of building new cells. We can actually grow cartilage and heart and teeth in petri dishes using stem cells. And so it takes that long to build all of the new cells to have it function differently. So we have patients who are really reporting the bigger difference between a 2 and 4 month period of time.
Well, so you have two pretty remarkable stories from your personal life. What about in your practice? Do you have any other conditions you'd like to share with us?
I have amazing, lots of patients who their blood glucose control has improved drastically and they're able to get off medications. We have patients who have MS and we're going blind and they're no longer going blind. We have patients who had MS and are walking out of their wheelchair with a walker. Cerebral palsy patients who have improved. I mean, we could just go on and on and on and on and on. But it doesn't work for 100% of people 100% of the time. Nothing in medicine does.
Right.
But it can also be incredibly transformative. And my practice is a little bit different. I feel like stem cells are seeds and our bodies are like the dirt. And do you do any gardening?
I do.
So dirt matters, right?
Right.
Like plant a seed in sand and plant a seed in rich soil with fertilizer, what you get is so different.
Right.
So we combine all of our stem cell treatments with a complementary nutrition guide, recipe book, and holistic appointment that's 1 hour, and we go over all the levels of health so that we can up level the hormones and the health that help the stem cells and
Right.
drop the inflammation. And there's no extra cost for that.
Right.
And I just feel like the holistic approach is the way to go.
Well, it makes tremendous sense.
Yeah.
It does. You need the good, rich soil.
Yeah.
Right.
If you're growing cells, you need raw ingredients and you need energy. And so the mitochondria and ATP and all of these things that I spent over a year researching.
Right.
But it's wonderful that there is research. It's not just good nutrition. I have many of my patients that say, oh, well, I eat very clean. That's great. You're further ahead than most, but we put you on a stem cell diet.
Right. What is a stem cell diet?
Well, it turns out that the stem cells are going to want some very specific nutrients. They want some sulfur-containing vegetables that are good for you, like broccoli and onions and garlic. That's part of the molecular structure for building new cells.
Got it.
And so people don't often eat 9 cups of vegetables a day. So we give you ways to do that with smoothies and making you have these recipes that sneak all of this in. The other thing is the mitochondria. The mitochondria provides the energy for every cellular activity in your entire body. And magnesium is a rate-limiting step to the production of energy. And it's been said that over 75% of the population is deficient in magnesium.
Wow.
It's a heavy, heavy mineral, and our farming practices are different now. We don't rest or rotate our crops. We don't leave our food in the ground until it's ripe. We fertilize from the top, and so the roots don't have to go deep. That may be part of the reason why, but magnesium's easy to supplement. So we have created a program where we are going to get your stem cells everything they need
Right.
to have the best production possible.
You said that not every patient responds. What is your success rate, would you say, overall?
So, you know, we have a clinical trial and we can quote a success rate. We've treated over 5,000 patients and we're in our 6th year. So each condition has a different success rate. For example, if you were told that you had to have a knee replacement, I can tell you if you're stage 1, 2, or 3, we have an 85% success rate that you're not going to have that surgery.
And what success rate does the operation have?
You know, the operation does fix your knee, but there are a lot of people who, A, it wears out,
Right.
because they want to go back to their regular life, tennis, running, hiking, and B, they still have pain.
Right.
Oftentimes the pain goes further up
Right.
because we're not perfect in creating the joint to be in line with the entire skeletal system.
Right.
My success rates at my clinic, though they're not statistically significant, are very high, and I think it has something to do with this holistic approach, and I don't know anyone else that's doing it.
So how would you treat something like Parkinson's, let's say?
Parkinson's responds well, and we have an experiment within our trial whether or not doing a lumbar puncture and introducing the cells into the spine in addition to the IV is better than just the IV. So we're currently studying that, but just giving patients IV treatments over time has helped over 60% of our patients.
That's pretty significant, because is there any other treatment for Parkinson's?
Well, there's some pretty scary treatments, right? The medications and their brain stimulation, you know, brain surgery, that's kind of got a list of side effects that you might not want to have. It's very interesting also that Parkinson's, in my research of nutrition, over 78% of patients that have Parkinson's are deficient in one specific organism in the gut. And that specific organism produces butyrate, and butyrate is involved in the interaction of dopamine. And we fix their gut, their symptoms of Parkinson's improve on their own. So we have a specific protocol for our patients with Parkinson's for their nutrition and gut healing.
Wow, so what?
I know, I research and read, and you know what? An incredible opportunity to change the future of medicine.
Is that what made you want to go into this? Because initially your practice was not stem cell.
No, I did rejuvenative medicine. I wrote a best-selling book called The Hormone Secret. It was published by Simon & Schuster. And I don't believe it's a change. You know, using bioidentical hormones or nutrition to reboot your adrenals and optimize health, you do get to sort of a stalling point, and using your own cells is just the next step.
So where do you see your practice in 5 years?
I want to have a network of physicians that do this holistic approach. We already have a few on board, and we want to just grow so that we can help patients. I want the cost to come way down. I want this to be accessible. And I'm a little bit angry with traditional medicine. And I know that's weird because I'm an MD, but I'm also board certified in naturopathic medicine. But I feel like if this was a pharmaceutical drug with the success rates of stem cells, it would have been FDA approved. But there's no pharmaceutical company that's pushing these studies, paying for these studies, and there's no huge profit because you can't patent your own cells. So I get frustrated and I feel, how dare they keep your own cells from healing you and your condition and preventing you from experiencing and living your most enriched life.
Well, when you put it that way, it seems somewhat outrageous. Well,
Right?
it's
And
my
we've
body.
had 0 adverse events.
0.
0 in 5,000. There's no medication that can say that. Now, does that mean that it's not possible? Anything's possible. That's why we're doing this study. But no infections, no deaths, no increased risk of tumors, no cancer, no hospitalizations, no bleeding. Nobody's gotten worse. The worst that has happened is that some people it doesn't work at all. And that's why we're studying, trying to figure it out.
Right.
What is it? Is it higher numbers that help? Is it different cell lines that help? We don't know. What an exciting time to be a doctor.
What an exciting time. So, I mean, what is it going to take for regulation to, you know, for the government or for whatever governs this to say, you know what, this is working. We've got to make this accessible to everybody.
I think just showing really well done studies that can't be argued with, that are done and peer reviewed, that show the safety and efficacy.
I'm thinking of people I know who have suffered, or people who've even passed away who could have benefited from this, and it's somewhat heartbreaking.
It is. It is.
And I just, I wish that I kind of wish this were available to more people at this point.
Well, that's the most exciting thing about this documentary series, is that there are so many people who don't even know that you could just fly to Seattle for a 3-hour procedure and then go home, and that it's right here in the United States. It's your own cells. It's not anything that you have to worry about with ethics or, your religion, because it's just your own cells. It doesn't even involve blood products. So we have Jehovah's Witnesses that can get this treatment. And they don't know it's available. So that's what's so exciting about this series, is that it's going to help get the word out.
So have you had any treatments yourself?
I have an appointment scheduled to bank myself. I'm very blessed. I don't have any aches or pains. I danced in a ballet company for 13 years before medical school, so it's kind of a miracle.
It is.
But what a privilege. I think every single person, regardless of whether or not you have anything going on, should bank your cells, because you never know. Nobody plans to be in the ER, the ICU, to have your knee blow out, a traumatic brain injury, a heart attack, a stroke. Nobody plans that.
Right. And we have a huge population that's getting older, so I think now's the time.
Now is the time.
Wow.
Yes, your cells aren't aging at the same age as you. That's why when you're 90 years old, you still cut yourself and heal. But they do get older, and they don't replicate as quickly or as much, and their numbers go down. But fat has the highest number compared to bone marrow or other sources in your own body.
You've treated your husband, you've treated your father. So
And my mother.
And your mother, what did you, well, you totally left out mom. How did you treat mom?
Well, she had aches and pains, and why not? If there's no downside.
First of all, how old is your mom?
She's 79.
So, of course, we get older, we sort of expect a certain amount of discomfort. So,
But why?
well, because our
If
bodies
there's a
are shutting
treatment
down.
for it, though, why put up with it?
Well, absolutely.
Yeah, but you're right. It is common that as we get older, and we live in an upright world that's filled with gravity, and our joints do wear out, and our backs, and women get osteoporosis, and the discs collapse, and all kinds of things. But wow, we can heal so much.
So you gave mom an intravenous,
Yes, and into her knees.
and how does she feel?
Well, her knees used to swell so much, and now they're not.
So how does this make you feel that you're able to provide this for people and you get these very definitive, life-changing results?
I feel like I am privileged, but also a huge sense of responsibility that I literally can affect how and when people die. And I take it, with a heart of gratitude that I'm able to participate in people's healthcare journey, but also really serious. That's why I do all the nutrition and the holistic approach, because if there's anything I can do to make it more successful, then it's almost like it's my duty. I should do that because I can.
Well, you're an instrument of healing.
Right, and it is just an instrument. It's your cells. I don't really do any magic. Maybe pray.
Well, if it works.
Yeah, why not?
Do you do any, let's say, beauty or rejuvenation kind of treatments with the stem
do.
cell? You do?
I do.
Share.
I do. So, most of my practice is based on healing conditions, but I, many years ago, did cosmetic medicine and was board certified in aesthetic medicine. And I don't practice regular cosmetic medicine anymore. We can actually take out a little bit of your fat, take it halfway between stem cells and your fat. So you may have heard of fat transfers. And what happened is that it wouldn't work. It had a 30 to 35% success rate because the fat would die. Well, fat is a living organ. It needs its own blood supply. So we figured out a way to have it filled with stem cells and micro beads of fat that resemble filler. And we can do a whole face rejuvenation, and so far it's been lasting up to 10 years. And just from your own fat. 20 cc's is all we need.
And it's a series of injections?
One time.
Just in the face?
We fill wherever
Fill where everybody
it
fills.
is, and that's where the artistic part comes in. And then we also put it on top of the skin and microneedle it to rejuvenate your collagen, the fine lines, and what's called dyschromia, your brown spots, your red spots, all of the things that happen to us, especially if you're Irish.
Yes. Wow. Yeah. And so you must have seen incredible results with that.
Oh my gosh. Yes. People literally look 10 years younger.
And it lasts for 10 years because fillers.
Well, so far, it probably will last longer.
Oh, so that's a very conservative.
Right. We've seen it 5, 6, 7. The prediction is 10 because there's no sign of it wearing off, so to speak.
That's incredible.
We also do hair. So we can grow your hair with stem cells with injections into the scalp.
And you've done this?
Yes, I do this every week.
Wow.
Yeah. Now, if people are smooth bald, it doesn't work.
Right.
We think that there's just nothing there to stimulate.
Right.
And it stimulates from the area of the hairline, so it's a series. And your hair is in one of 3 growth phases. Mm-hmm. It has an active growth phase, a resting phase, and a transition phase. So the hair is only susceptible to growing with stem cells or with the eyelash growing things that women, or with laser hair removal to actually stop growing in the active phase. And you have anywhere from 30 to 70% of your hair in the active growth phase. So you do a series of treatments so that you get each of the hair as it comes into the active growth phase. And you can grow your own hair thicker and more strands.
Wow.
I know.
Yeah. Kind of amazing.
Kind of amazing. And we do the holistic approach with that as well. We get your blood work to see if there's a hormone level. There's no point in us growing your hair back for you with these injections and then you having a high level of DHT, dihydrotestosterone, which causes the hair to fall out. I mean, that's just silly. So we make sure that you're a good candidate.
That's just incredible. Tell me about arthritis.
Arthritis is the injections of the stem cells into the joint and IV, and you can do all kinds of joints, ankles and knees and those little tiny nodules in the fingers and elbows and shoulders, and it's amazing.
And it gets rid of it?
And the majority of the time.
That is incredible.
Well, because of arthritis is really the joint is deteriorating and we have an inflammatory response.
I mean, this can really change people's lives.
Yes.
I mean, it can keep them being productive and
active.
Which and enjoying what they like to do.
Traveling and playing tennis or walking or playing with the kids.
Or grandkids.
Yeah, exactly.
Oh, that's wonderful. So earlier you mentioned stem cell banking. How does that work? And where do these stem cells go? How do I access them when they're gone?
Well, I do not have, nor do I want, a license to store your biologic material. So we use a banking facility that's in the United States because I think that's important. I think that there is some legitimate concern with sending your cells off to Mexico or even Panama or wherever. So we extract the fat from one side and do your procedure that day, and we do a second harvest to send the cells overnight. So we are only able to do the banking procedures Monday through Thursday, because there's no overnight delivery on Friday. And the banking facility receives the cells. They do a test to make sure that there's no microscopic infectious process. Can you imagine how horrible it would be to incubate, replicate, store, and then re-inject back into you? So there's an infectious disease blood test we do, and then the banking facility actually tests the sample. And they do the replication and the banking. And then we can call those cells, and we can literally say, well, send me 10 million cells, or send me 3 doses, and they ship it overnight to you. And we use my address because they're your cells, but you probably want them shipped to the clinic so that we can take care of them. We put the cells in the fridge, and when you arrive, we give you the package, which is your package, and you open up your cells, and then we process it and do the injections.
Wow. So,
I know.
So you extract, and then do you do any of the sort of like the processing there, or you extract and it goes directly?
There's a certain protocol that we have to follow in so that it goes in a very specific container and a very specific box with their ice packs to protect the cells from degradation, and they check them. It's a checks and balance system that I love.
Right.
And some of the conditions that benefit from multiple treatments over time are the chronic conditions.
Right.
A lot of the arthritis and joint conditions are successfully treated with one.
Wow. And where is this place? I mean, I'm sort of imagining this huge refrigerator someplace.
Yeah, it's in Florida. So they have a facility where they just, I haven't even visited it. I would love to, but I just checked their credentials, the important stuff.
That's incredible. That's incredible. So here your fat is flying from Seattle to Florida and
Yep.
back again.
Yep, in this big old scary container that says biologic material and all of that. But
Right.
that's because you don't want to, though the procedure is not that bad. My father, 79, and he took a Tylenol afterwards. You have a little bit of discomfort from the liposuction, but you don't want to do that over and over and over and over again.
Right. Is
And
there a stitch or something, or is it?
No, it's 1/8 of an inch incision.
Wow.
I know. So we just put a Band-Aid and wrap it for the swelling. Yep, it's crazy.
That is absolutely incredible. And then how long would my fat cells live?
If we just left them out?
No,
or
in the facility.
Oh, well, we've been storing stem cells for decades and decades and decades with, baby's cord blood. And
Right.
so that's a technology that has been around a long time, and it can be for a very long time.
Right, so it's your lifespan.
Yeah,
Wow, that's amazing.
I know. And you will have, with the replication, you'll have enough cells for many treatments, 10, 15 treatments, depending on how many they start with.
Wow.
I know, it's crazy. It's so, when I think back in medicine, I think back to the big leaps in medicine, and I think imaging was one of the more recent ones, to be able to actually look inside and see an MRI or an X-ray. And prior to that, it was antibiotics. And I think this is that big.
This is the next thing.
I think what's going to happen is that our children, or the next generation, will look at our scars from surgery and go, oh, how old are you? You have one of those? Like the smallpox mark, that it will show how far, because these things just won't be done anymore. We'll be using our own cells via a small injection to treat them, and we won't have these big, huge scars and downtime and deaths and adverse events and side effects.
I was at a lecture once, and somebody was saying that so many of the answers to the world's problems are right in front of us. Mm-hmm. And to me, it seems so amazing that the answer to your own health could be contained within your own body. I mean, that just seems very profound to me.
I think that's the definition of what medicine really should be. It should be using things to get your body back to homeostasis so it can heal itself.
We're kind of an amazing machine, aren't we?
We really are. If we stop hurting it with what we eat and breathe and lack of exercise and chemicals and things like that, we really are designed to perfection.
We have a friend whose son has cerebral palsy.
I got a great story about that.
I'd love to hear it.
Yeah.
Tell me, cerebral palsy, how do you treat it?
So cerebral palsy isn't one of our typical conditions that we look at for stem cells. Usually we're looking at things that have acquired in our lifespan. Either we've worn out a joint, or we got MS, or we got Parkinson's as we got older. Cerebral palsy is something that is there and it detected early on. And so I have a wonderful story to share with you about a patient that had cerebral palsy. So I speak frequently at physician conferences for stem cell medicine and teach physicians this holistic approach to stem cell medicine. So I was speaking at a conference, and the woman in front of me was walking up, and her gait was a little bit unsteady. And so I just was thinking to myself, wow, we should give her stem cells and even more. So she got to the podium, and she was the recipient of stem cells with our clinical trial using the fat-derived autologous. And she had had 5 treatments. And she used to be in a motorized scooter, living at home and going to school in special education, because she was kind of trapped in her body. She couldn't communicate well, she couldn't ambulate, and she couldn't live independently. So she walked, without a cane, without a walker, to the podium and spoke about her apartment, her boyfriend, and college.
Oh my word.
Yeah,
Oh, I'm going to start crying.
yeah.
How did you deliver the stem cells? Was that
IV,
just IV, not a lumbar puncture?
IV. Then it goes everywhere. And there's no blood-brain barrier to your own cells.
I had never thought of that.
But now that you do, it's quite obvious and acceptable. When you have something, you get a concussion or something, which is another story, your brain heals. Why does your brain heal? Well, your own stem cells go past the blood-brain barrier, because there's no barrier to your own cells, and heal your brain.
Let's talk about Alzheimer's.
So we have some early results that the dementia associated with Parkinson's, Alzheimer's, and other forms of dementia are being improved with this. And that's where another huge component of the gut comes in, where I hope that we can really help patients by combining the two.
That's incredible. So what in the gut leads to Alzheimer's?
It's the microbiome that, have you ever thought, well, it's interesting that we say I have a gut feeling when you make a decision. Well, it turns out your brain neurotransmitters, the majority are produced in your gut by the organisms in your gut.
Wow.
So when you have food that you're eating that is sugar, or food that turns to sugar quickly, and you crave that sugar more, it's not you. It's the organisms that have increased in population that are fed by sugar that are now making brain neurotransmitters to tell you to have that craving.
Wow, so it's not my fault.
Exactly, exactly.
That makes me feel a little bit less weak.
Yes. Our microbiome outnumbers the cells in our body.
Wow, so in combination with treating your gut, stem cell IV. So is it that the stem cells just sort of go to where they're needed? Are they sort of like the body's special forces? They see where there's conflict and they rush there?
And that was studied. They were tagged with radioactive isotopes and imaged, and we watched. Oh, it's in the right knee, not the left knee. It's just fascinating.
That is amazing. Wow. What other types of chronic conditions have you seen a lot of in your practice that you've treated this way?
Well, there's so many. It just breaks my heart. There are so many conditions that patients have, and so many unusual conditions that we don't have a lot of statistics, because there's just not a lot of patients with those conditions. But the autoimmune conditions seem to respond really, really well. And then traumatic brain injuries. We have a rat study as well. And the rats only receive their stem cells via their tail vein. And then they navigate a maze. And so we see their cognitive function based on their ability to navigate a maze. And the rat that was given a concussion and stem cells is doing the maze at 3 months as well or better than the rat that did not get a concussion at all. And the rat that got a concussion that didn't have stem cells is still getting worse. Oh. We now know that concussions are progressive.
Right. So you talk about professional athletes and okay, shoulder injuries, knees blown out, but really concussions is a really big problem for
Yes.
football players, hockey players. How can stem cell treatment help a concussion?
It can result in no deficit if it's given right away. I mean, I've had many meetings with the military, and I would like all of our special forces and all of the military to have their own cells banked and ready and available, that a medic could just simply start an IV if an IED went off or somebody got a head injury, and just prevent all the sequelae. Because when a soldier gets injured and when a soldier gets a traumatic brain injury, now the organization called the military has lost their soldier. It costs a minimum of $10,000 to train a soldier. So that's out. They've got to get somebody else. But more importantly, the family has now become affected and the community has been affected. So I know it sounds lofty, but I truly believe that we can actually change our communities by getting each individual person more healthy. My husband and I are involved in helping some of the homeless in Seattle. And a lot of the homeless people on the streets are vets. Oh. And they tell you stories of their traumatic brain injury.
Wow.
And can you imagine? And it's less costly than all this medication and the social issues that come out of this. And exactly.
We happen to work with some veterans, and what they're saying is that it's not just having a concussive injury, it's being around the constant blasts that affect their cognitive abilities, and they think that maybe some of PTSD is being around those constant blast.
Absolutely.
Is this something that you think could be helpful for that?
I would love for us to be able to explore that in a bigger way. Right now, we can treat vets. At my clinic, we actually have a program for when somebody does the stem cell series, they're gone, if they choose, that part of their money goes into a donation pool, and then we treat a military vet for free.
I have one for you.
That's great. There's no shortage, but I'm happy to keep learning about more. Unfortunately, we're only allowed to treat the vets. We're not allowed to treat any of the active members,
right,
because the military organization is very blocked off from outside influence. And especially the special forces, they're like $1 million horse races, and
yes,
they protect them.
Yes.
But one day, this might be mainstream and part of the military so that they can be protected.
Yeah, they get your blood, you get their
Or maybe
blood
we'll
type.
stop having wars.
Well, of course, that would be nice too. But now, you're talking about, okay, we stop having war. You're talking about prolonging life.
Yeah, and quality of life.
And quality of life. But now suddenly, what is going to be the economic impact of something, of people living longer?
But if they're living,
people?
But if they're living more healthfully, I mean, the biggest cost of an aging population is their health. What if they were healthy? What if you were to be able to live vibrantly well into your 90s or into 100, 110, fully functioning? What if? That wouldn't be a drain on our health care. They'd be contributing members of the society. Grandparents we could get back the family, instead of daycare taking care of our children, we could have the extended family. Because the reason that grandma and grandpa don't live near or with the family is because they need so much care. What if they didn't?
That's a beautiful question.
Yeah, you can just keep going layers. Your imagination isn't big enough to imagine that if our cells could heal, could they prevent? Who knows?
Wow.
Yeah, it's exciting times. Great time to be a doctor, like I said.
So in your practice, I know you can't say things are 100% safe. How safe is this really?
Well, I can say they're safe. What I can't say is that there's a 0% possibility that there will be some kind of an adverse event. What I can tell you is there hasn't been so far. So though it is possible, it is not probable.
What kind of adverse event might there be?
Well, I think that the ones we're watching for are infections, bleedings, hospitalization, your condition getting worse, death, tumor formation, and cancer.
Have you read of any instances of this with the stem cell treatments?
With using your own cells, there have been a 0 incident
So those are pretty
in
good
over
odds.
5,000 cases,
Those are good odds.
right? Can't say that it's not possible because we don't know everything in medicine, but it's not probable.
But anytime you get an injection or an
A
incision,
blood transfusion, I mean,
anything,
there's-
you're
yeah.
opening up the skin and you're opening up the possibility for something.
Yes. Yeah, I think there's a lot of fear around new medicine like stem cell medicine, and that's why I tell people don't trust, look at the data.
Right. Do your homework.
Yeah, do your homework. Work with somebody that's part of a clinical trial so that you know that you're going to get a standardized protocol that's been studied and evaluated and repeated over and over and over.
Now let's go back to our veterans. We have
Which is funny because I'm Canadian, but I have such a heart for
It's
the
hard.
vets.
It's hard not to when you think of what they've sacrificed
Yeah,
for us.
yeah.
So we have a very dear friend who is a Silver Star recipient who has had multiple injuries. His knees, he broke his back. He was first with the Marines and Special Forces. He was a Force Marine Recon. And then he decided, after 9/11, he decided he wanted to train to be a pararescueman, which is a very, very elite group of guys who literally jump into battle to save other people. He's a medic. But in doing so, he's injured himself a number of times, and he's in pain. He's in Alaska, and
It's close to Seattle.
Close
We have a lot of people who fly down. We have people who fly from all over, Taiwan, the
Right.
US, Europe. Yeah.
but we would love to maybe have him come to your clinic and film him being treated.
It would be my privilege to see if I can impact his health in a positive way and help him enjoy the rest of his years pain-free and see if we can get him out of pain. It would be wonderful. Let's do it.
You're on.
Okay. That's great. I'm excited.
Well, thank you so much for coming here today and
What a
speaking
privilege
with
to
us.
be here. Thank you so much.
So I wanted to give you an update after I had my stem cells done in my left shoulder from my surgery I had in July of last year. And then on August 3rd, I got the stem cells done in this shoulder. I went back to Alaska to work, and it took about 2 weeks before I really started to notice that there was really much of a change. And within about 5 weeks, I had increased my range of motion. I was out of pain. And the other thing is that it just seems to continue even now to get better. And today is October 13th, and it's even, my range of motion is even increasing more and more. I can get my hand almost all the way back up between my shoulder blades, where before I could barely get it back to my waist. And because it's there's really not a lot of pain like there was before, I'm able actually to work that range of motion so that I can increase it. The other thing is that happened about a week or two after I got back from getting the stem cells, my right shoulder started to go kind of go on the fritz from doing too much, sleeping on it all the time because I had the surgery on this side, from overuse, using it more than the other one. And so as soon as I got home, it's been 2 weeks. Yesterday, I got stem cells in this shoulder. So already in 2 weeks, I can feel the difference. I'm probably a good 50% better just in 2 weeks. So I just wonder what would have happened had I done the stem cells first in my left arm before surgery, how much of a difference that would have made in recovery time and just the whole healing process without having to go under the knife. So my testimony is that this is, to me, like a miracle shot in the dark. But I'm ever so grateful that I have found this, and this will be my method of healing over surgery any day.
Before we continue, I just want to thank you so much for taking this journey with us. This is such an important subject. So many things have been talked about along this journey, along this way, and you know what? We want you to own it. You still have time. For 50% off right now, we've offered a whole selection, a menu basically, of ways that you can have this be a part of your collection at home. I just have a question for you. This is something I'm concerned and even I just don't understand. How old do you have to be to have your stem cells removed? And then if you need them later on, what's the age where you can receive them?
Well, the earlier you harvest your own stem cells, the better. So let's say you harvest your stem cells when you're 21 and you need them when you're 80. Those stem cells are frozen in time from the moment that they're removed from your body. So your 80-year-old self will be receiving stem cells from your 20-year-old self. There's something absolutely beautiful about that. Now, as far as an age when you can receive stem cells, children receive stem cells for leukemia and for other issues. You can receive stem cell treatments at absolutely any age. As far as harvesting, really the earlier the better. We should all be doing it now and banking it.
My name is Tracy Thompson. I was diagnosed with multiple sclerosis 18 years ago, so it kind of took me out of the workforce, and I primarily spend my time. We co-founded a group called Patients for Stem Cells, and we do advocacy and kind of educational, connecting people who have chronic diseases and are out of options.
Tell me about your MS, how it started, what your symptoms were, what eventually led you to stem cell therapy.
I was 30 years old. I had just gotten back from Costa Rica, been on an amazing vacation, windsurfing, just having a great vacation. Came home, and about a month after that, I started having just this, my right leg would get weak and it would give out. And one day I thought, well, I just need to go run, I guess, because something's wrong. So I went out in the heat of the day in Texas and went jogging and came back and sat down and just like narcolepsy, just completely just kind of passed out. And I woke up and I thought, gosh, something is not right. And a couple of days later, I was doing something in the kitchen and my leg gave out and I fell down. So my sister's father-in-law was a physician. And I think he knew right away. He said, I need you to just go to the hospital and meet a friend of his who was a neurologist. And I was extremely fortunate because I was diagnosed right away. Within a month after having my first symptom, which a lot of people wait years to find out what's wrong with them. It's because, it's a multitude of symptoms that can mock other things. So I was diagnosed just right at 30 and, immediately started MS maintenance drugs, was anxious to see what I could do. I remember when the doctor came in and I just said, what is that? What is MS? Do you have a book or something? Because, I thought it was MD, which is, like one of Jerry's kids. I thought, I have no idea what I was dealing with. And looking back, I think it was a blessing in disguise because I wasn't fearful of it because I just didn't know. I thought, just we can fight this. Just tell me what I have to do. So that's, I went along the line of traditional therapy, went to a neurologist, tried the MS maintenance drugs. Tried several of those, and my body, I was that small percentage every time that had the bad reaction to it. And by the time I was, 5 years into my disease, I didn't have any real outward symptoms, but I had no drugs to take. So I, at that point, realized, okay, I'm a no-option patient. I have this disease that's trying to take over my body, and I have absolutely nothing to do to take it, for maintenance. So I just wasn't willing to accept that, and that's when I started looking into alternative treatments, and the adult stem cells was what I started reaching out, which it's changed a lot, but at that point, social media has developed since then, but I reached out to someone who was a local police officer that was doing a fundraiser, talked to him, and that's how I started learning about the stem cells and kind of followed in his footsteps after he went for his treatment out of the country.
So when you say you were having adverse reactions to the drugs, tell me what that was like.
The drugs themselves cause, at that point, when I got diagnosed in '99, they had really just come out on the market, and there were only injectable drugs available. So I believe at that time there were 3. It was betaseron, Avonex, and Copaxone, and those carried the side effects primarily of flu-like symptoms. So you'd inject yourself. One of them was deep muscle, you did once a week. The other 2 options were, I think, every 3 days, just subcutaneous. But every time you'd inject, you'd get, chills and start feeling sick, which they said they would subside, but for me, I always had a negative reaction to it. It got to the point where I was suffering from depression from them. Injection sites, they were cratered in where I had injected in my arms and legs and rotations. Quality of life was just not good at all on those drugs, so they would switch me. I tried the Copaxone and that one wasn't working, so they put me on the deep muscle shots with Avonex and wasn't reacting to that drug as well. So at that point, we were waiting. That was before the infusions of Tysabri, and now they have oral drugs, but at that point, we were pretty early in the game on them having any type of maintenance drug other than what they did for relapses, which was steroids, high-dose steroids.
Now you had 2 young children at this point, and your marriage had...
When I first got diagnosed, I was actually a year into my diagnosis when I had my first child. So by the time I reached the point where I knew there were no drugs to take, and I had a 3 and a 5-year-old. And I knew for my kids, I needed to do whatever I could just to be a mom to them. Because I was, at that point, I would sleep all the time. Couldn't go, if they had a softball game or something, I couldn't go sit at that because the heat would take me out. So it was a huge quality of life issue more than anything with my MS in the beginning.
Well, also when you have young kids and you feel like you're missing those wonderful years, it's got to be very frustrating.
Definitely. I mean, coming home and mom's always sleeping, and it's like, why, you want to play with them, you miss out on their life. So they said it's hard, the invisible symptoms are difficult to deal with, but there's good and bad in that. So mobility wasn't my issue, but could I function in life? Could I actually go participate in their lives? That was limited, and that was difficult.
You're a single mom, you've got 2 young kids, you're really eager to find something else that's going to work for your MS. So what led you to stem cells?
I saw an article in the newspaper, and it was a local police sergeant who had MS, and he was going to try an adult stem cell therapy out of the country. And so I reached out to him, connected with him, we got to be close friends, and he pretty much mentored me through the whole thing. He was a pioneer at that time, because it was 10 years ago, there weren't many people that were going out of the country. There was a big fear involved of what it was, and it's enough to go to another country, you don't know the language. It's kind of an intimidating process. So the patients started kind of bonding together and mentoring each other through and talking to each other, talking about their experience, and it was kind of an underground thing, I guess, if you will, on finding another way to treat our MS that was outside of the box from traditional therapy.
So you go to Panama, correct?
It was in Costa Rica at the time.
So you went to Costa Rica, and what did that treatment look like?
At that point, it was a mini lipo. I did a combination therapy of a mini lipo, which was my own fat cells, and then I also got some injections of umbilical cord cells. So that was, at that point, prior to leaving, I could not go outside. I was sleeping all the time. I got home, I remember it was in August, and it was almost immediate. The heat intolerance was gone. I actually almost broke my ankle because I was in the backyard with my daughter, and I was trying to do some gymnastics because I was just so excited. I was like, oh my gosh, I can go outside, I have energy. So it completely changed my life, and moving forward with my children, being able to be involved in their lives. So for me, it was just an amazing experience, and I knew at that point that I had a sense of security about my disease because I thought no matter what, this is an option, it's a viable option that I can go to, and I've had 5 treatments since I first went. Some of them have lasted. The first one, I went 5 years without needing another boost. I kind of look at it as a maintenance drug for my disease now. Instead of some people do monthly infusions or whatever, this is like an annual maintenance therapy for me to maintain my disease.
So you were so sold on this treatment. I mean, obviously you were feeling great. It basically had reversed what was going on with your body. You became part of a grassroots movement with other MS patients. Can you tell me about that?
Yes, I felt like I kind of had a calling because I had so many friends with MS who had started at the same time as me, diagnosed around the same time, and they did not have the same outcome. Their quality of life, some lost mobility. I had a friend that was a scientist that she lost her home, got divorced. I mean, she pretty much lost everything because of her disease, and it makes you feel a personal responsibility that you need to kind of fight for and bring hope to people who've basically lost hope. Because they know about traditional therapy, they knew about what their neurologist was telling them, and beyond that, they felt like this is what their life had to be. So we started out doing some advocacy with the MS Society. I chaired their government relations committee. They did some great work, but we were not doing anything about stem cells at the time. So I went to a clinic that was temporarily in Texas. That was about 5.5 years ago. And the FDA shut that clinic down. So after having to go out of the country and then getting a taste of what it was like to just go to Houston, so close to home, to go get that treatment, a group of us got together. There were 3 women that just decided, you know what, we're gonna have to try to move this forward any way we can. So we created a group called Patients for Stem Cells. And nobody's paid, it's all volunteer. Patient-based platform to give us a voice and mentor others and just let them know that there are other options out there and they're attainable. There are safe places you can go. As with anything, there's people who might want to mislead you, take your money, so we kind of mentor them through questions to ask and connecting them with patients. For me, it's real-world evidence. It's looking at somebody who prior to that trip, maybe they had no feeling in their right arm, they come back and they have feeling in their arm again. No side effects to it. I mean, you listen to other people, and we know our bodies. You know when your body's telling you, if you're reacting well to something, a drug is a drug. It's different in every person. So one person can take it with no reaction, another one has a very different reaction to it. Stem cells, they're not in that category. It's something we take from our own body, something with the healing capabilities to go in, migrate to damage, and elevate our quality of life. So it's a no-brainer. There was no question about it. I have a total sense of peace about doing the treatment.
Now, your group was very instrumental in getting a bill passed in Texas. Can you talk about that?
Yeah, so we were very fortunate to get involved. Going back to our early advocacy efforts, I have a close friend of mine who was a state rep who had MS. And so he was, prior to the clinic opening 5.5 years ago, he was a part of trying to get stem cell legislation together. So we kind of started that campaign there. And fast forward, 5 more years, and then in session, just so grateful to Tan Parker and Drew Springer and all the wonderful men that got involved in a personal mission on this. But we knew how important it was to put a face to it and to connect with people, because everybody's touched by it. Every office we went into, just right away when we walked in, oh, my mom has MS, my aunt has MS, or Parkinson's, or there's just a multitude of diseases and that everybody's touched by it. So to make it a personal mission and to go in and connect with people and get them involved, it was totally bipartisan. It's a humanitarian effort. I mean, it's about medical freedom. I mean, having the ability to take my own cells out of my body, which are not a drug, it's something out of my own body, you take it back out and you put them back in.
Now, what kind of advice would you have for patients, MS or other diseases, in other states? How can they get legislation passed in their state? How do they start a grassroots effort like you did?
I think Texas has set a precedent here that we'll see as it falls out over the next few months and goes through the process. It'll be that much easier just to take it and to mock what's happened here. But I can't say enough how important it is to have that voice of the actual people who are suffering from the diseases. Your visibility is so important there. So we're willing to mentor our group. We've been contacted. There's so many people that are willing to help, but the most effective thing to me is to go in and tell your personal story in a positive light. It's not always, you're not going to agree with everything everybody does, and we tried to make sure it was always, I don't care if you're Democrat, Republican, that doesn't matter. What matters here is we're doing the right thing. And if you approach it in that manner, that's a big part of advocacy. Keep that personal side away, keep it positive, and just tell your personal story and connect with them.
Right. Now, there's so many other diseases besides MS that can potentially be treated by stem cells. Do you see a lot of sort of splinter groups having their own sort of personal groups, or do you think you guys should unite?
In a perfect world, what I believe, Jenny's co-founded with me along with another woman, our vision has always been to get all of these groups on the same page. There's power in numbers, and we don't want to work against each other. So you don't want to have one person going into an office on an issue and 15 other people coming in on the same thing. You need to unite on that effort, and that's easier said than done, but it's our goal and something we've tried to do for sure.
Now, how do we as citizens contact the FDA?
Well, that process is not an easy answer to that, because they do have public hearings. The last one was in September, when they were going to start changing some of what's currently in law right now with the minimal manipulation of cells and same-day clinics, and they were making some changes to that. It's not the same type of process you would do from a legislative perspective. You don't actually go in and lobby. Our group did flood we were a big part of having, when they opened it up for public comments, it was more than they'd ever had on any agendas. They ended up extending that on the hearing on when they were going to have it. The people that were opposed to it, we outnumbered them by far, but did they receive that information and did it make any impact? It did not. I mean, I believe that they already had their mind made up on what the law was going to be. It was a formality, but I don't believe it was by any means for them to really consider any of the information that was given, because it's, what's happened to us as patients over and over again is you have academia or, which most of them, it's a conflict of interest because of their research dollars. And they're saying, we're protecting the patients, we're protecting you. You don't know, and it's not safe, but they don't hear us, because I'm standing here 10 years post-stem cell, 5 stem cell treatments, no side effects. I'm one of many, many people who can say that, and they won't even take that into consideration. So my real-world evidence has 0 impact on it, none. They want it, put it through a lab, put it through years. I don't have years. I didn't have years when my kids were young. And if I had listened to that, I don't know where I would be today.
How do you feel about your right to be able to try whatever treatment you'd like to try?
I believe if you are faced with a chronic disease and you have gone that route, I'm not anti-FDA, I wasn't opposed to anything, but I found myself with no options. So when you hit that point, what are you supposed to do? You fight. Most people fight. They try to figure out a way to sustain their health and to just live somewhat of a quality life. I'm not asking, nobody wants to be cured. You don't just give me some quality of life and let me be the judge of what my quality of life is. So I think it's just to try to tell somebody, if you haven't walked in their shoes, you don't have the right. For me, we don't know if MS is genetic or not. Would I do anything possible to keep my kids from having it? Of course. So would I be a lab rat to keep them from? I should have that option. So that's, I mean, again, until you're personally touched by it, until you walk in our shoes, I just don't think that you can get it or you have the right to tell me that I can't do it.
Wow. So how do you feel about potentially having stem cell treatments covered by insurance? And what do you think we can do to band together and make sure that that happens?
I think when you look at the average price of my disease for an insurance company, which I'm not on these drugs, but you're talking about $70,000 a year in one maintenance drug for an MS patient, not counting the MRIs, going to the neurologist, the drugs other drugs that are included in that. You look at what that costs as opposed to me getting a one-time $25,000 treatment that may last 1 to 5 years. What's more beneficial for an insurance company? I mean, from a financial standpoint, it makes complete sense that you would say, but from a pharmaceutical standpoint, that money, they're not willing to let go of all of that. So I think that's part of our problem on why it's so opposed. Insurance, clearly the cost savings in that would be, and it's not just MS, it would be for a multitude of diseases.
So what advice would you have for somebody, let's say, who's watching now, just got a diagnosis of MS, is sort of overwhelmed with options and medications, different ways of attacking it? What would be your advice to them?
What we do, we're very careful with that because I never want to take hope away from a patient. If there's an MS patient who's been on an MS drug for 5 years and they aren't having relapses and they're happy, I would never tell them, oh, you need to stop doing that. That's not my role. But what we do want is somebody who has exhausted those, or they can't tolerate the drugs, or they want to do something different, to educate them and let them know that there is another option out there. But our mission is never to find everybody who's on a drug right now or who's newly diagnosed, because it's so overwhelming when you first get diagnosed. I mean, for me, one day I was in Costa Rica, and then later I'm going, wait, I can't go out in the sun, I can't walk. I mean, it's it's a hard adjustment. So you really ease in and you let everybody do it in their own time, and it's their decision ultimately, and we should support it either way, whether it's to do the FDA route or to seek an alternate treatment like adult stem cell treatment.
So it doesn't sound to me as if you're anti anything. It sounds to me as if you want people to have the options of choice.
Correct. That's, the whole thing with the FDA, I'm not opposed to them in any way. Now, they did have a gross overreach and power the way they took control of our bodies on the cells, on how they categorized our cells as a drug. I don't agree with the way that was done. I'll never acknowledge or agree that that something comes from my body is a drug. So we're talking about two different things here. When you're talking about the FDA, do I believe they should be regulating it at all right now? Am I violating anything with the FDA? In my opinion, I'm not. So I'm not against the FDA. I think that they do not belong regulating this part. Don't tell me that when you take fat out of my body, you expand it to a therapeutic dose, you reintroduce it back into my body, and you want to patent that or sell it or call it a drug. I don't understand that. So there is a misconception on saying that we're radical, which our group has been under attack for, that we don't believe in any regulation. That's not the case at all. It's far from the truth. But in this instance, it does not apply.
Now, there are always going to be, in any industry, there are going to be, or certainly in any medical industry, there are going to be instances of people who are quacks, who aren't the best practitioners, who maybe don't know what they're doing. So do you believe in some sort of a regulatory body for that?
Oh, absolutely. I definitely do. And I think this is best left between a physician and a patient. That's where it lies, and that's where Texas is going right now with the Texas Medical Board. Clearly, you need to have it regulated, but The few cases that are cited over and over again, like the bone shard in the eye, that was medical malpractice. It was an inept doctor that did something unethical. It was not the actual cells themselves that grew the bone shard. There was a serum that they put in there. So, you know, these things are cited over and over and over in the media. The same, I think it's 6 cases. I don't know, it could be off on that. But that's all they have. So even if you want to say, okay, let's just say that there were 6 adverse reactions out of the 580 plus clinics in the United States right now. On those odds, is it not safer than taking Advil? So you want to tell me again about safety and everything, then I'll give you that. Let's say that they're not, but let's look at those numbers compared with the number of treatments that they've done, and it's still just exponentially safer than any FDA-approved drug out there right now.
Now, you know, you said something earlier. You know, you're taking fat cells out of my body. These are my fat cells.
I want my fat to go away. So.
I mean, some of my fat cells I would like to leave my body, but I guess there's some benefit to having some of them put back in. I don't understand how something that comes from my body is thought of as a drug.
Right. If you go back to the late 90s, going into when it went into on the Federal Register, I believe it was 2006 or 2008, it was a one-word language change that the FDA did. It was they called at midnight, they basically did. They're supposed to have a public hearing before they do it, which they did not in this case. The language was supposed to be for transplant patients, for organ transplants, and they took 0 regulation over our drugs to 100% control over my body. So you have blood transfusions, there's things that they do all the time that they have, like blood transfusions. Why is this different? Why are we saying now that you can't, it's something from my body that you're taking out, reintroducing. It just doesn't make sense, other than from a financial standpoint that I believe it is too threatening to the FDA and all the drugs that are basically out there for symptom management. There are no drugs for cures. There's no drugs that elevate your quality of life. It's basically symptom management.
So explain this to me again. At one point, it was okay. There was some sort of a midnight session where wording was changed. There was no hearing involved. And suddenly, literally overnight?
It wasn't overnight. It was over a period of time. But ultimately, it came down to changing one word and putting it on the Federal Register by the FDA. To me, it was just a gross overreach of power. It infringed on my medical freedom, on medical liberty, having the ability to make a decision with my doctor on what my best line of care, what my best treatment should be for my disease. I don't see any way that they belong regulating this, which, it's the case now. That is the law, and that's the way it's been for several years. But I think we all forget to go back and look at the beginning of how it even originated and why it is the way it is today. Why are we even having this dialogue? And why, I'm grateful for this law in Texas, because that's the way it should be.
What do you think of regulations for people who have, they just get a diagnosis, listen, you have 3 months to live. They want to try everything. Mm-hmm. Why should that be regulated?
I've actually sat in and heard testimony, which is unbelievable, on the opposition of how, again, it goes back to patients, we need to protect you. And, I just say to that, let's put you in that position. Let's give you 30 days to live, and you have paperwork that's 3 weeks worth of paperwork to get you to something that could possibly help you. By the time you get to that point and go through all the red tape and all the regulations that you need to do, your body's too weak at that point, and there is no hope of it. Who has the right to deny that? What are you protecting somebody from? If I'm terminal and I'm told I have X amount of days to live, if I want to go get the craziest treatment ever, why can't I? And if it will help move things forward as well. So you go in and you try some crazy treatment and you think, that had a really bad reaction, and that person was willing to do that and say, just use me. At that point, don't you want to make an impact with your life? Don't you want to do something positive? And if something you can do towards the end helps other people, I don't know anybody that wouldn't choose to do that. So why we would want the government or anyone else coming in and telling us, oh no, we're just going to protect you. You can't do that.
Protect you from what? Dying anyway?
It doesn't make any sense. But I said I've sat with and heard testimony of them. You know, I gave testimony at in the Senate over the Texas law, and the gentleman that opposed it was saying the same thing. You know, they're being preyed upon. They don't know what they're doing. I said, do I look illiterate to you? Do I look like I would somebody's just going to call me on the phone and say, you know, I'm going to give you a stem cell treatment and you can walk and you do this, and I would believe that? So give us some more credit. That they're hiding behind this facade that it's rhetoric that they put out there to act like patients are so desperate and they're getting ripped off. And let's say I paid $25,000 and I still didn't have my mobility, but 5 other symptoms resolved that made my life much better. Who's to tell me that that's not acceptable? And that's what we've come down to. Who's the judge? Who's going to sit and say, this is okay, yeah, you've got that symptom, so that justifies the money, but you didn't get this, so that you were ripped off. I mean, it makes no sense to me.
Well, these seem like very personal decisions.
They are.
These are value decisions that seem like we should be the ones to be making them.
Absolutely. I mean, when you're faced with a disease, whatever it might be, it's enough to hear those words. You know, you have a chronic disease, you have whatever that is, you know your life from that second forward is forever changed. So how you choose to battle it and fight it is, you know, have that right taken away from you. It's something that's it's infuriating. And that's part of what Patients for Stem Cells' mission was, to kind of empower those people again who have been told, we've been attacked by it, we've been accused of being paid off, we've been, you know, you speak up for what's right, for people just trying to sustain their health and trying to just survive. And you get viciously attacked for it by people who are making tons of money out of it, who have financial conflicts of interest. We don't have that. It's our health. That's all we have. The only thing we have to gain is our health. That's all we're trying to give.
So where do you hope to see this battle in 5 years?
What I hope is what happens in Texas would be similar to what happened with, you know, federally with marijuana. It was illegal, couldn't do it, but you can go to how many states? 11 states now, and it's legal. If we can do that with marijuana, why can't we save people's lives? That's the part that I don't get. So hopefully it could mock that, and we could just kind of override and say, all right, FDA, step out. Let each state decide what's best. Let a patient decide what's best with their doctor, and step out. We'll get plenty of information. They're not doing it irresponsibly. There'll be registries. The data will be, I mean, I already know too many people that I've seen that their lives have been dramatically changed on it. So we know that this is a positive thing. We know it can help, and there's no side effects. It's the safest thing you can do with amazing results that give hope. So we should be able to do it.
Tell me about the academic conflict of interest.
Probably some of the hardest opposition that we face as patients, which many of them hide behind the fact that they say they are basically protecting patients, and that's even though they don't listen to us, and we've reached out and you try desperately to, here's my story, here's what it is. You see that they really don't want to hear it. It's about a conflict of interest it comes down to money. It always comes down to money. So if they have the research dollars towards something that they've been working on for however many years in the lab, and this suddenly trumps that, then their work, all that they've done, and their future grants are drying up. So it's about it's a business model, their livelihood. How are they going to keep their money coming? It's not by acknowledging that your adult stem cells work. So everything that we're doing in this research thing is for naught, because you know, we've taken, and many of them, I mean, millions and millions of dollars, and what's come out of it. Has anything gone into clinical application out of your lab? A lot of it hasn't and doesn't. Some of it does, but again, it's going to be a conflict of what happens with adult stem cells.
Well, thank you so much for sharing your story with us today. This has been absolutely fascinating.
Thank you.
My name is Dr. Hassan Badai. I'm board certified in physical medicine and rehabilitation, board certified in pain management, and I manage and treat musculoskeletal acute and chronic pain.
What types of ailments do you see that are most common in your practice?
Very commonly, from my training, I see a lot of orthopedic slash chronic pain that is associated with diseases, processes that have been anywhere between neurological, musculoskeletal, as well as other systems, GI related and internal medicine related pain. But for the most part, it's a lot of orthopedic. So that really tends to be between the spectrum of spine and peripheral joint and sport related injuries. And the space that I basically practice in is the space between surgery, neurosurgery, orthopedic surgery, and physical therapy. So there's an entire spectrum of pain management or patient care that is in the space that doesn't require surgery and is more interventional than a physical therapy or chiropractic management for people's pain.
So how do you manage chronic pain?
The tools that we have in front of us currently, we have traditionally used anywhere from the conservative medication management, and going forward we push to a higher level of pain control with our opiates, such as the short-acting and long-acting opiates, for example, the fentanyls and the OxyContins and that sort of speak. Now, we also, it's a multimodal treatment approach is how I approach it. We also get involved with interventional treatment in the sense that we're involved with steroids and other type of spine procedures involving nerve ablation treatments for spine-related pain and other types of modalities. Now, what I've learned along my training when I was in Georgetown was that the advent of regenerative medicine has now been a tool I have incorporated in my practice, in my day-to-day practice. What does that entail?
Yes.
So along the research that I have come across, we're seeing an evolution of the way we are incorporating the body's own inflammatory response, the healing mechanism on how we basically assist in the tissue repair mechanism. So what I'm doing is enhancing that through the treatments of, for example, as of where I am today, mesenchymal stem cell therapy, which is now readily available to us as providers as a treatment option for our musculoskeletal and soft tissue injury patients.
Wow.
So, yeah.
So tell me, what does the stem cell therapy look like?
So I speak to a lot of my patients who always ask me questions like, what is this regarding? Or how does this, how are we able to get to this point? So our body already naturally produces stem cells. And so the question is, well, where can we get the stem cells? And, you know, I've discussed with patients, there are options and there are different approaches. People can retrieve the blood from the bone marrow and then basically spin down the blood to the stem cell and then treating that product into the ailment of concern. Another option, alternative, is the Oedipus-derived or the fat-derived stem cell extraction. Now, those two particularly have to deal with a procedure to incorporate a procedure.
Right.
So now, where we are today is we're incorporating umbilical cord blood as an extraction mechanism to get the mesenchymal stem cells. And today, predominantly in my practice that I have in Orange County and LA, we are using predominantly umbilical cord blood derived mesenchymal stem cell therapy for patients' comfort, ease, and lack of possible or potential intraoperative complications.
Right.
So it's a very simple, unsophisticated procedure that patients find to be very comforting versus the extraction process of a bone marrow aspirate and that type of thing.
So there's bone marrow stem cells or stem cells derived from fat, both of which it's a procedure to actually get that, spin it, clean it, re-inject it, or you could get the cord blood, which is delivered and then applied. So how do you deliver the cord blood stem cell to a patient?
Essentially, these stem cells have already been processed through tissue banking guidelines, which is regulated by the FDA, and through a distributing arm are cryopreserved, delivered to my practice. And we store them at a minus 80 degree Celsius refrigerator, sort of, speak. And what I do in my office, we do predominantly musculoskeletal related pain. So under ultrasound guidance, I have a background in MSK ultrasound, and we'll do shoulders, knees, ankles, Achilles, and any musculoskeletal tissue related pain and tissue injury under ultrasound. So
you'll inject it with the guidance of an ultrasound machine?
For the most part, yes.
So tell me, what procedures do you treat with stem cells most often?
So because of my background training, I started with musculoskeletal as the chief main areas of my treatment protocol. However, what I've read and I've learned and I've researched on is possible treatments through systemic delivery of mesenchymal stem cells.
So that's an intravenous?
Yes. And so I understand stem cells have a immunomodulatory response, which helps for multiple conditions. I've expanded my roles to include autoimmune conditions of various sorts. So I have introduced IV mesenchymal stem cell infusion in my practice as a therapeutic option, and in addition to peripheral joint treatment injections.
So you've been seeing tremendous success with delivering the stem cells both intravenously and directly into the joint?
So I'm developing these protocols as we speak. So what I've noticed that, developing, a direct joint treatment with an IV infusion treatment simultaneously has provided a response both locally and systemically for patients who have chronic musculoskeletal or non-musculoskeletal inflammatory pain. And so I've seen good results. I've seen improved energy levels. I have seen improved libidos. I have seen things that I was not expecting to incorporate. I've seen, improved range of motion on many different joints that I've seen treated.
Do you have some particular stories that you'd like to share about the sort of miraculous?
Yeah, in the beginning, we don't really have a lot of data in front of us from the AMA standpoint. We don't have a lot of data in front of us. We have promising reports and we have good randomized control trial studies out there. But I see that this is going to be a potential treatment option for the musculoskeletal interventional treatment world for people who don't want surgery, don't want steroids, don't want opiates for pain control. So what I thought was my mother, who was an avid hiker and still is, had a meniscal injury in her left knee. She went through the realms of therapy and bracing and topical anti-inflammatories. She got to the point where her pain was so bad that she couldn't go up and down the stairs. And I'm sure most people are under this understanding who suffered these kind of injuries. Early on in my regenerative medicine exposure, I've discussed with her, this is an option, we're gonna go forward with it. And what I did was I incorporated a 10 million mesenchymal stem cell injection treatment into the knee, as well as an IV associated with that. And I'm not kidding you when she is now walking 7-8 miles a day, hiking 7-8 miles a day. She feels significantly improved range of motion, pain controlled to the point where she is ecstatic. So I don't like to treat my own family, but however, because of that, I'm treating her friends. My own brother as well was involved with a labral tear, and he's post-operative. Pain was not controlled. His range of motion was limited. I've injected multiple musculoskeletal treatments from this. So, I mean, my own family, I believe in it. I believe that the future of the way we practice medicine is going cellular, and we understand that the stem cell treatment option is becoming more and more likely, and will be the wave of the way I practice medicine. So I'm very confident that what we're doing is a treatment that will provide improved functionality, decrease their pain, as well as lower their pain medication requirements.
Is this safe? Have you seen any adverse side effects?
Anecdotally, I have not had any problems from any of my patients regarding complications, side effects, issues, and I have not heard anything from a national scale on what the issues were. Bleeding, infection, nerve damage, the same as if you were to get a flu shot. I'm very confident with the fact, and it's all about educating my patients, but I'm very confident with the fact by letting people know that these stem cells that we get from an umbilical cord blood are immunoprotective, meaning they don't have proteins that would be rejected in a host body, as if you were the recipient of a allogenic source, which is an outside source. So when you're doing a blood transfusion with red blood cells, I have to match your blood cells, right, if I'm going to give you my blood cells. So with stem cells, they're immunoprotective, and there's no issues with graft versus host reactions. So I feel very confident, and I let my patients understand that it's very it's been anecdotally been very safe, and I have not heard anything nationally in terms of any immediate reactions to it. So, I understand that, we're still early in our treatment phase, but it's so far everything has been pretty receptive, and I have not had any issues. And again, the patients are in front of me in my clinic, and their quality of life has been affected. Their functionality has changed. Their activities of daily living has changed. And I'm sitting here giving them the options of what they can do. And I give them, this is the traditional treatment plan. However, there is this new branch of medicine that can be promising and should be incorporated in their options of to improve all of these things that I have mentioned.
Well, thank you so much for coming here today and speaking with us.
It's been a pleasure. Anytime.
And that was the end of episode 9. Actually, that's the end of the whole series of The Healing Miracle. I want to thank you so much for taking this journey with us. As this continues to air until the end of the night, you still have that chance to own this whole collection for your own personal use for 50% off. Sarah, I want to thank you so much for taking us and showing us so much about this critical subject and for being a part of this. Really enjoyed this time with you.
Well, thank you. I really enjoyed meeting the amazing people that we got to meet across the country who shared their stories and really important information, helping you make the best choices about your health.
Thanks again.